My name's Dena. I'm an advanced clinical practitioner with iCares. I cover the residential and nursing homes in Sandwell. COVID has been really difficult over the last 12 to 14 months, both professionally and personally. I looked after residential and nursing homes, and COVID was very, very difficult for those. There was a lot of deaths, people dying on their own. But personally, I lost my father at the beginning of COVID in April of 2020, and so that was a very difficult journey to experience. So when we found out that my father was asked to come to the hospital because he was dying and was asked to come to ITU, it was a very difficult decision because you can only have two people, and we are 5 children and my mum. We knew what to expect, or I knew what to expect as a nurse. What I didn't expect was when I got in there, gloves, mask, can't touch him, very, very impersonal. And my dad was a Jamaican man from Jamaica, and culturally we talk about death all the time. I knew how my dad wanted to die. He wanted to be pain-free and peaceful, and he was. He talked about his funeral, he talked about how he wanted us all dressed, what he wanted to wear. So culturally, death is spoke about all the time, and it's important. I think NHS staff need some teaching and guidance on how to speak to families, especially because in the NHS we're dealing with families from multiple different cultures, and if we don't have an understanding of that culture and how that family will accept or receive your message, it's very difficult. So I think now I'm quite blessed. I'm from multiple cultures, so English, Nigerian and Jamaican. And all 3 cultures celebrate the end of life very, very different. And I call it celebrate because you have to celebrate that person's life. I think in the NHS we need to be a bit more empathetic and sympathetic. Your words are the last words that family is ever going to remember. The advice I would give to a nurse is to be kind, to be honest, and to feel comfortable in saying what message you've got to say. If that means that you're going to cry with the family, cry with the family. It doesn't matter. What matters is how you say the message to that family. It's really important. If you're going to be cold, the family are going to see that you're cold. But if you are genuine, the family are going to see that you're genuine. But it's about being kind.